Zoya. Hello, Dr. Morse. I want to begin by saying how much I admire you, and thank you, Zoya. Love you too. Lots of love, and lots of love back to you, dear one. My history is short. I'm 22 years young. Look at that. 22 years old. I grew up eating junk food, constant headaches. I did too. I grew up with not just headaches, migraines. Oh. And then, of course, we had piano lessons and all that we had to take with migraines. My mom made us take piano lessons. Oh, constant headaches, never had a regular monthly cycle. So first of all, we're going to go, are you on the short side at all? Now, of course, we're going to go to the pituitary when we see irregular monthly cycles on the ladies. You can go to the ovaries, but your better bet is going to go to the pituitary, the regulation of that. So that's the first order of business, to take a look at that pituitary gland. So if you went on the female reproductive formula, it has chaste tree or vitex berry in there, which is for the pituitary gland. So it's a good rounded, more progesterone-rich type formula. I do not make a black cohosh type formula. That's an estrogenic formula. I only use, say, black cohosh or estrogen type herbs when, let's say, you have vaginal dryness. That is an estrogen issue. And so black cohosh will increase estrogen in the body. Some women that have had hysterectomies have low estrogen now because the adrenals are down. That's adrenal estrogen. And if you're skinny, you probably don't have much fat cell estrogen. If the liver's not producing enough estrogen type, then you're not going to have that as well. But first of all, I see pituitary. I would get my period once in 7 or 8 months, pituitary big time. My gynecologist diagnosed me with POTS, and prescribed me with birth control pills. You know, that's what I'm talking about. Now, here's a lady that has monthly cycle problems. She's only 22 years. How's she going to bear children and hold to term? She's not. She's going to abort somewhere down the line or have a hard time conceiving and things like this. And you don't want to, sweetheart, you want to get yourself fixed up and strengthened before you try to conceive and have children. And the pituitary is one main area. Well, that brings then questions about GI tract problems, sinus problems, maybe the pineal's involved and you have insomnia. Oftentimes those twin glands are involved. So it's something important. I've got an appointment here in a little bit. Is he here?
Within the next 5 minutes, he should be here.
Let him wait.
It's my mom's fault.
Oh, it's your mom's fault. Yeah, let him wait. That's her dad. Got. So POTS is polycystic ovarian syndrome. So what's happening is when you get ovarian cysts, is he here?
He'll be here shortly. I'm so sorry. That's my fault.
I'm talking to my friends.
Okay.
I see. That means she's getting multiple ovarian cysts. And so what system would you say that cysts come from? Same as the tumors? Yeah, have you ever seen the foot in a cyst? Yeah, highly acidic, absolutely. And where are we going with that? We're going to the kidneys again. So when you see the POTS already, you already know kidneys and adrenals are involved. Well, she's 22 years old, so without saying it, your kidneys and adrenals are involved. I mean, you wouldn't be off at all, ever, at a 22-year-old on the planet Earth. Now, but I suggest that the pituitary is off as well. Now that brings other problems because the pituitary also controls the kidneys and the adrenal glands, everything, basically, hypothalamus and all of that, absolutely. So you see how this gynecologist just was so pseudo in the thinking that really wasn't focused in on the client? Because when you have irregular monthly cycles, and you don't, and as much as 7 or 8 months apart, and you just say, well, go on birth control pills and stuff like that. I mean, you don't need much of an education to tell a woman that, do you? And yet people beat me up for my school, and it's like, excuse me? You know, I mean, that's why women get in trouble. because of stuff like people like this who can't nail down their problem right. Oh, you come in here and tell me that, I'm going right after you. I'm going after that pituitary. I'm going to make sure that when you get pregnant that you can hold the baby and that the baby's going to be healthy. Took the pill for 3 years. Shortly after, I started getting cystic acne. Yeah, that's because your kidneys and adrenals are down. Of course, that controlled the lymphatic system. Now he gave you more estrogen, which then, what? Spurred up, because that wasn't the problem. Estrogen wasn't the problem. Your pituitary is the problem. So this stimulated more acidic natures in the body, and therefore you got to see your cystic acne. In other words, you got to see what's going on with your lymphatic system. It's in your face, sweetie. It's in your face. Your lymphatic system is a problem here. Constipation. She had constipation, diarrhea, eczema, rosacea, anxiety. So let's back this up. Anxiety, adrenal glands, then controls the lymph system, giving you rosacea, eczema. Could be constipation, diarrhea, neurologically, like a Brady Tacky thing. Itchy skin all day long, so you know that's high fungal problems. So your body's full of fungus, your adrenals are off, so you don't have good sugar metabolism. So what's your blood sugars? You might end up with some low blood sugars or the opposite in the future. Not if you fix it right now, though. But you got to fix your adrenals to fix all this, but I'm suggesting to you got to go upstairs and fix the pituitary gland. That brings suggestions of going after the GI tract, because we've talked a great deal about that. For those that comes to level 2, you know, we really get into the transverse colon and the relationship to the sinus and head areas, and that relationship to pituitary weakness and pineal. Almost impossible to have a pituitary gland weakness and not a transverse bowel weakness in the location that is embryonically and symbiotically related to. However, 2 months ago I found a pea-sized hard lump, just a matter of time. This is just a matter of time, sweetheart. Hard lump on my left armpit. My sister wants to take me to the doctor, but I'm scared. Yeah, that might be something you don't want to do right now, is probably go to that. Okay, all right. I'll finish this up, but he is welcome to sit if he wants. It's up to you. All right. When you see this hard lump in the armpit there, that's just showing you further evidence. This is just further evidence that your problem is lymphatic and kidney, part of it is kidney lymphatics. That's the skin part, that's the anxiety part, that sort of thing. Now, I don't like it. It's a pea size. And I have witnessed one of my clients being killed allopathically by going after a pea size with chemo and radiation. You know, that's easy to deal with, but I would just put myself, since you need this all through your body, I just put myself on a 10, 20, 30, or 40-day grape diet. And I do it now. If you're scared, then you want to get right on a grape diet and do it now. Because if you are scared, be really scared if you go allopathically. The first thing you want to biopsy a lymph node. Well, if they damage or destroy the lymph node, well, you're done there for whatever tissue that's involved. So you don't want to play their games. Not worth playing their games, because they have no remedy for you, only pain and suffering and despair. So I'd be turning this around and realizing what system is involved, going after that system. You're a young 22, you know that system is going to be down in you anyway. Anybody that's 30 or below, count on it. Go to the bank and say, my kidneys and adrenals down. Now, can I borrow $1 million? There's my evidence. Absolutely. You see, my grandmother had arthritis, heart disease, died of breast cancer. My mom had fibroids. My dad has kidney stones and diabetes. So basically, you're saying that your whole family, dear one, has kidney and adrenal problems. Because everything you mentioned here is kidney and adrenals. Kidney stones, kidney weakness, to acidosis, diabetes, the adrenal glands on top. Your mom has fibroids, which is the lymphatic system, of course. Breast cancer, which is the lymphatic system. Heart disease, depends what that is. Because they call it heart disease, but what is that? Blood, nerve, and lymph problems in the flow of the heart? Or did the heart tissue have problems? And if they had problems, which system gave them the problems? Well, there's only one generally that does that, and that's what? The lymphatic system. Absolutely. See where we're going with this? Arthritis, of course, systemic acidosis. So she had severe kidney, chronic kidney and adrenal glands, and here is the downline from that, already getting a pea-sized thing. Now, this tells me I have lots of work to do, but, well, take a picture of your eyes. But I am not sure what to do. I also have eczema right next to my lump. Yeah, well, doesn't that just show you that's lymphatic? Oh, look, my lymphatic system's back up there. I need to get it opened. Kidneys go after the adrenals, start going on that fruits, berries, and melons. It takes that level to win this game. So just get your mind set on it. I'm going to do fruits, berries, and melons. I'm going to do a normal program to get my kidneys filtering and the adrenals up and all this stuff cleaned out, and I'm good and done. And I've just corrected my genes. I'll have my monthly cycles on time now. I can bear children. I can carry them to term, and I have healthy children. I'm not going to continue my family's genetics. Because you're right in kidney and adrenals big time, and my guess you're chronic levels if their parents are involved at this level. I ordered the first kid and I've been on fruits, mostly bananas, change that up to grapes. I try to buy as much grapes as I can. I also include some salad once in a while, helps with cravings. Go after that parasite in a little bit, do a dropper and a half, maybe 4 times a day, because when you're high fungus, that's rough for a while. It really is. Which tincture should I focus on? I also checked and found out my kidneys are not filtering. Didn't think so. Please point me towards the right direction so I can heal and avoid going to the I would. Lastly, I'm required to go get some vaccines done for school. Will that come in the way of detox? I would find a way to not vaccinate for school. I would try to get out of that by religious thoughts or whatever you can. And if you do belly up to the beast, then I highly recommend you tell them thimerosal free. Whether you can tell whether they're doing that or not, I don't know. I don't believe anybody anymore like that. There are classic liars everywhere in the allopathic community. The CDC centers lie, the medical doctors lie. It's like, who tells the truth anymore here? We do, I'll tell you that, and I hope our group does, because I hope we stand up for truth, honesty, and integrity, as funky as that might sound to some of you guys. That's good karma. And who reaps good karma? You do. You know, not the next person, you do. So I tell you what, I'm going to close this off because I've got someone to see here. And so it's enough to say, my dear girl, look at the protocol video that we have, but you're going after full bore. You're going after kidneys and adrenals. You want someone to write you up a protocol for the lymphatic system, where you have a lymph node 5 and lymphatic 5 involved. And you really want to focus on those kidneys. Try a dry fasting 12, 24, 48, whatever you can to start filtration. Keep working with this. But if I'm you, I'm going to jump on a 40-day grape diet. I had a young girl, she was about 22, came in to see me one day, and she had a left breast tumor the size of an egg. She brought her friend in with her. So I told her what she'd have to do, what system's down, that sort of thing, to get rid of it. She said, okay, I can go on that diet for you. I said, but you could give me a 40-day grape diet. And she said, well, I'll think about it. So she came back in a couple of months, and I was seeing how she's doing. She says, well, I did your 40-day grape diet. So did my friend. This tumor is almost gone, and we're going to go on another one. So you see, it really is powerful when you focus in on the system that's the problem. You focus in on the foods that are for that system. You focus in on the tissues that's involved in that system, and you have a win-win-win all the way around. But look at your genetics, see how you're going down your family tree. You can't conceive that you're gonna have some problems with aborting and not holding your children to term. You want to fix this now. You're only 22 years old, your pituitary's down, your monthly cycles are very radical, and none of that's good. You want to fix this and get that all straightened around. Plus, if you're having transverse bowel problems, that's going to lead you into a lot of digestive issues, and then, of course, the head area. So, in all ways, looking at your family history and everything else, you want to deal with this, dear one. All right? All right. I've got to go now. I love you guys. Thank you so much for taking this on. It's a wild ride, isn't it? All right? But remember, who is in control of your world? Who's driving your car? Right? Is it your mind? Is it your thoughts? Or is it you, your consciousness? So remember that. Remember how to grab a hold of your mind. Step back from thoughts and become the observer for a while. Let all that information come to you. And then use your mind, but don't follow it all the time. People chase their thoughts all the time and they lose who they are. They live in their thoughts. They live in their desires. Don't you? It's a higher level of experiencing life. Well, I love you guys. The next video, we'll see you later.